bring in Himanshu Baid, co-chair FICCI Medical Services and Devices Committee, Managing Director, Medicure, because one of the areas this budget did focus is medical tourism, pharma. The fact is that there has been a genuine attempt, particularly with medical tourism, to give it boosts with various benefits being provided. Your first reactions to that? Do you believe specific sectors will benefit more than necessarily the entire economy? These will be specific wagons that will move ahead.
Thank you, Rajdeep. I think, first time we have seen some detailing on the healthcare sector, especially for future economic growth. And especially this Biopharma Shakti mission for 10,000 crore allocation, expansion of NIPERS, stronger CDSCO, especially to accelerate innovation, approvals, global competitiveness. I think all these were called out. And relief on cancer drugs, then medical value tourism hubs. First time government has given focus on MVT, which is a very big sign because I think India has a great capacity to handle foreign patients. And the way our healthcare is today growing rapidly, I think we are pretty much up there in terms of delivery. So I think for assistive devices, all that is pretty much called out, which was pretty much not there in any previous budgets. So I think very specifically called out, positioning healthcare as a social and economic multiplier.
Okay.
In terms of reform, since you're talking about that particular sector, why do you say that there has been no efforts in the past for this sector?
I think it was, when we looked at CDSCO, and I'll talk from medical devices perspective, pharma and medical devices were governed by just one single organization. I think a stronger CDSCO means there's a deeper approach for approvals, innovation, global competitiveness, which was never there earlier. So I think there's a special focus on these areas.
Himanshu, I'm looking at NIMHANS, setting up of a NIMHANS 2 and upgrading National Mental Health Institute, establishing emergency and trauma care centers in district hospitals. That's how it is looking like in terms of larger benefits for this, healthcare sector. That doesn't seem to be there in the pointers that I've just read.
See, basically, if you see the last budget, there was a focus on oncology, onco care centers, 200 centers were announced and 700 more to be, over next 2-3 years. So I think it's a beginning of, where we see special focus in these areas. It will take few years for these things to come out and develop, but I think the focus is, pretty much there for advancement of technologies.
Okay, so there is a reaction now coming in from the Trinamool Congress. Abhishek Banerjee is speaking. Let's listen in.
दिखाया कि पिछले 4 साल में ग्रामीण सड़क में जहाँ पे 60% पैसा केंद्र सरकार का देना बनता है, वहाँ पे 10 पैसा दिया है. मैं राजनीति छोड़ दूंगा. स्टेट मदरली ट्रीटमेंट और एटीट्यूड. बंगाल में आप हार रहे हो, इसलिए बंगाल के लोगों को सबक सिखाना है. लोकतंत्र में सबक जनता सिखाता है. राजनेता या राजनीतिक कोई पर्सनालिटी नहीं सिखाता है. जनता के बल और जनबल के आगे किसी का नहीं टिकता है. कोई अगर सोचता है मेरे पास ताकत है, मैं जनता को सबक सिखाऊंगा, जनता फिर से सबक सिखाएगा और आने वाले चुनाव में जवाब करारा मिलेगा.
आने वाले चुनाव में जवाब करारा मिलेगा और कहीं ना कहीं जिस तरीके से स्टेप मदरली ट्रीटमेंट केंद्र सरकार वेस्ट बंगाल के साथ कर रही है, उसका जवाब आने वाले चुनाव में जरूर मिलेगा.
So politics as expected has started. Rajiv Mantri, expected lines, the reactions that are coming in. We expected opposition to talk about how there is nothing much.
Those states which have not really been highlighted will always speak out that they didn't get this and they didn't get that. This always happens, so nothing surprising.
Well, they can always grow coconut.
No, but that's also a very old world. This is like the old railways budgets that used to be there. Unless a train ran from a particular MP's constituency, it wasn't seen as a budget that was fulfilling the needs of a particular state. But
which is very parochial and
that's right. This is a union budget at the end of the day, and I think as we are saying, there are certain focus areas that should be highlighted: cancer drugs, medical tourism, education. Logistics,
the tax break on data centers tells us how much importance the government is placing on data localization.
Sure. So, I mean, I think the government, as I said, you can look at this budget two ways, and this is the way it's going to be looked at. Those who believe that the government has given that much needed focus to key areas. There will be others who will say that maybe the government should have provided, as Dr. Baru keeps insisting, a clear intent of the direction in which they are taking the economy in terms of encouraging people to invest across the board and tell us therefore where the growth trajectory goes. So those are two clear views that are emerging. I don't know whether N.K. Singh is still with us. Because, Mr. Singh, much of this also the heavy lifting will have to be now done by the states. The Finance Commission details have come out, and we've seen about 19 states have revenue deficits at the moment, some of them whopping given the scale of the dole economy. Should that be a concern? We don't focus on state budgets enough, but states is where governments are simply don't even have money at times to pay salaries on time.
I totally agree with you, Rajdeep. In fact, you have perhaps taken the words from my mouth, that while we are excessively preoccupied with the fiscal and the debt trajectory of the central government, and we focus on it, we have scarcely any focus or a means to focus on state finances. Day before yesterday, you are absolutely right, Rajdeep. The report of the Reserve Bank on state finances came out, and that presents a grim picture where fiscal deficits have slipped, raises broader issues in what kind of a freebie economy and so on the states can do. But what can the central government do? Rajdeep, I want to ask you, this is a question I have posed myself several times, that under the 7th schedule of the Constitution, and since we will not in a position to alter the 7th schedule of the Constitution, as long as the state borrowing is upon the security of the consolidated fund of the state, and since the Indian Constitution doesn't provide any recourse for state level bankruptcy, while keeping the finances of what the world looks at, you are right, is general government. It doesn't look at, an investor doesn't look at central or state government. In fact, Rajdeep, the ironic circumstance is today,
Mr. Singh, just hold on to your thoughts.